Okay, so good. This is the Senior Master Coordinator, Bob Ferguson, and it's my distinct pleasure again to welcome my very good friend and birthday brother, September 9th, rocks, Rusty Ost. Rusty is a master pharmacist and as he self-describes, a weeds and seeds pharmacist. Learned pharmacy when you were running around with little bags of stuff, seeds and rhizomes and everything in your pocket, right?
That's right. Weeds and seeds, that's what we called it. Had 100 of those little baggies.
Wow, we're impressed. Anyway,
Yeah.
So tonight what we're going to do is talk about heart health. Now, gosh, it was so long ago that when we made our presentation, when the heart presentation in the old tape days, it was on an audio tape. So
Yes.
that's we're totally dating ourselves.
Cassette tape.
Yeah, we were a cassette tape. But anyway, Rusty has an astounding personal heart health story and also, of course, tremendous domain knowledge as a pharmacist and someone who has been in the health arena for many, many, many decades. So what we're going to do is just start. Rusty, I'll turn it over to you. And if you want to share slides, let's rock and roll this thing.
All right, I'll do that. So thanks everybody for coming on. And as Bob said, I'm not unique. There are unfortunately a whole lot of people like me, but here I was, almost 20 years in Shaklee, and I took care of myself, and I tried to eat right, and I tried to live right, and I tried to think right, and we were down in Florida. We did a lot of speaking around the country 20 years ago, and was down in Florida did a presentation in Orlando, and then we came down to visit some Ohio friends here and where we currently live. And I had a heart attack, and I didn't know it at the time. I just didn't feel good. I didn't have the proverbial elephant sitting on my chest, but I didn't feel good, and my left arm hurt, and I kind of thought it was probably angina. Both of my parents died real early of heart disease, and so as much as I tried to take care of myself, I picked the wrong parents, so to speak. So I knew I had that to overcome, but I told Jen I was going to get my blood pressure taken at the drugstore, and instead, my friend and I went out and played golf. And as I played golf, I got to feeling better. And so when we got back to Nebraska, I went to the doctor, and he said, well, I don't think there's anything wrong with you. And I said, well, I want to know why I have angina. So they did he did an EKG, and he said, I don't want to make the call on it. So he referred me to a cardiologist, and the cardiologist said, there's nothing wrong with you. And I said, well, then why does my arm hurt? And he said, well, then, all right, we'll do an angiogram. And I said, well, there's got to be something a little less invasive. So to make a long story short, I miserably failed the stress test. And the next day they did open heart surgery, and my 4 coronary arteries that fed the main parts of my heart were blocked: 197, 93, 199, 97, and 93. The lower quarter of my heart was dead because that was the part that was fed by the artery that was blocked 100%. And so long story short, he told me I had 2 years to live, and I said, I'm not gonna live in the snow and the cold. So we moved to Florida, and 20 years later, I'm still here. And I guess maybe I'm like that old Timex watch, I took a licking and I keep on ticking. But anyway, I didn't go back to work. We'd had a Shaklee business for 20 years at that time, and so I left the traditional practice of pharmacy, and I joined June in our Shaklee business, and we still get along. We do have offices at opposite ends of the house, but we get along, and we've been married 53 years, so I think it's gonna last. I would like to delve into anatomy a little bit here, and talk about the heart, and I'll bring up some of that stuff. I'll talk about the fact that when I was in pharmacy school, my cholesterol was 360 and nobody cared because it was before they linked heart disease and cholesterol. It got to 480. That's the highest reading I ever had. 480.
Wow. Wow.
My last one, by the way, Bob, was 139. So let's talk a little bit about the heart. You know, it's about the size of your fist. If you're 6'8" and 250 pounds, your fist is bigger than a person who's 5'2" and 110. And so is your heart. But your heart's about the size of your fist. And it's an amazing machine. It beats 100,000 times a day, pumps 2,000 gallons of blood every day. And so it's pretty amazing. But today, 120 million Americans have heart disease. That's almost 50%. So if now we have, because of social distancing, we can't look around, but the next time you're in a group, look around and you know, all the people around you have heart disease. It's kind of crazy. The cost of heart disease in America is $1 billion a day. You know, 650,000 deaths a year every 37 seconds. It's crazy. Of course, the most common cause is narrowing of the arteries due to atherosclerosis, which is depositing of fat in the arteries. And surprisingly enough, the first symptom of heart disease overwhelmingly is death, the first symptom. And they told me, the doctor said, you should not even be here. You should have died 15 years ago of heart disease. He said, I don't know what you're doing. And we'll get into that in a little bit. But he said, you know, you and I need to talk because you ought to be dead. And so the circulatory system, as you can see, you know, that the hearts, the lungs, the arterioles, the capillaries, the blood vessels, of course, deliver nutrients and oxygen to the cells and carry the waste away from the cells. But blood vessels, end to end, would equal 60,000 miles. That's just a lot of blood vessels in your body.
That's unbelievable, isn't it?
Yeah. So we'll talk a little bit about cholesterol. I told you mine was 480. So if that means anything, that means I probably know more about cholesterol than a lot of people. And I did go on I went on a really austere diet, and he said, you know, people don't do what you did, but I was scared, and I knew that my genes did not preclude me from having heart disease, so I had to do something to overcome it. I wasn't a smoker. I wasn't a diabetic. Now, I had been a smoker, which brings up an interesting thing. When the doctor came into the recovery room, he said, do you still smoke? And I said, no. He says, how long ago did you quit? I had to think because it was during Vietnam. I said, 30 years. And he said, well, I just wondered the minute I opened your heart, I knew you were a smoker. He said, the American Lung Association will tell you that lungs clear in 10 years. But he said, coronary arteries never clear. Once a smoker, you've got opaque coronary arteries. They are rough and they begin to collect plaque. And he said, if you take if you take an unaffected coronary artery and you lay it on a newspaper, you can literally read the print of the newspaper through the artery.
Wow.
But once and he said, unfortunately, secondhand smoke does the same thing. And so anyway, the good news is that, you know, cholesterol is modifiable, so you can change it. You can read the statistics there. It's kind of sad that, you know, 29 million Americans have cholesterol levels above 240, which is considered high risk. High cholesterol raises the risk of heart disease and the risk of stroke. It's actually the same disease, it's only geography. If your arteries in your heart get clogged, you have a heart attack. If the arteries in your brain get clogged, you have a stroke. And so It's just that. And just a lot of cardiovascular disease and a lot of strokes. Everybody knows somebody that had a heart attack. I have family members who died way, way earlier than my parents, in their 40s of heart disease. It's extremely genetic, and you can't pick your parents, but you can live your life based on what you know. And if you're 12 years old, it's not too soon to start. And if you're 70 years old, it's not too late to start. And you can overcome a lot of the ill effects of heart disease just by changing your lifestyle. And we'll talk a little bit about some of that, but a little humor here.
See, I've got a question. I had heard that, and this was before fast food, junk food was quite as prevalent as it is today. But when they did autopsies of the guys who died in Vietnam, they were finding 17 and 18 and 19-year-olds with fairly advanced atherosclerotic disease.
And that's the only advantage of war, is that it allows the autopsies of hundreds of people that normally it wouldn't. And so during World War II, they found heart disease in 40-year-old, 50-year-old soldiers. During Korea, they found heart disease in 30-year-old soldiers. And during Vietnam, you're right, 17-year-old boys that were killed in Vietnam had post-mortem autopsies. They showed heart disease. So,
wow.
You know, that's one of the bad things about degenerative diseases, is the fact that it's, you know, we now have our grandparents' disease, diabetes, heart disease, you know, obesity.
Yeah.
And we'll talk about that.
Yeah.
But we have to add a little humor. So I put Ziggy in here because if God wanted us to be thin, he wouldn't have made fattening foods taste so good. And that's exactly what makes food taste good, is fat. Fat and sugar makes food taste good. And it's a tough habit to break. So now let's talk about what we can do about it. And the question is, are you getting enough? And scientific research has shown that a fourth of 31 to 50-year-olds don't get the basic vitamin C requirements. And these things should cause a person to consider adding nutritional supplementation to their overall optimum health regimen. And it really is clinically proven that supplementation is beneficial. But you no doubt have heard about all of the work that's been done with vitamin C and the coronavirus, right? They're treating people with high levels of intravenous vitamin C, and they're getting some results. And this isn't to say that if you take, you know, 3 or 4 vitamin C a day, you're going to cure coronavirus, because I don't think that's going to happen. But I do think that it can improve your immune system. And obviously, because it's an antioxidant, improves the health of blood vessels. It's got to help with heart disease too. 40% of adults over 55 are B vitamin deficient. I was 57 when I had my heart attack. And the cardiologist came in. He was a cool guy. He was from Canada. I chose him because he was doing what he called beating heart. Typically in open heart surgery, they take your heart out of your body and they put it on a heart machine and they work on it. This guy was doing a beating heart, where they would collapse a lung and go between the ribs, and they would work on your heart while it was still in your body. And that appealed to me. But he came in and he said that for me, that didn't work. They had a 45-minute window. And he said, I worked on your heart for 7 hours on the table. And he said, you have the heart of an 80-year-old brittle diabetic. Anytime I touched your heart, it would just cringe away from the instruments. And so he said, your homocysteine levels have got to be off the chart. Well, Jiminy Cricket, my wife, June, was sitting there, and she got very offended because she knew how many Shaklee supplements we took. And she challenged him, and she said, "I'll bet they're not." And sometimes she doesn't have a lot of tact. And so he wasn't offended. He just said, "Okay, I'll prove it to you." So they drew the blood, and he came back, you know, an hour later, and he said, "Now you really have my attention. Your homocysteine levels are normal." And so we talked a lot about it. And later on, he gave me a CD that he got from the American Heart Association for continuing education on nutritional supplementation and heart disease. And it was stuff that Shaklee had been doing 5 or 10 years before that. And so that's how far behind the American Medical Association was. But anyway, almost every 31 to 50-year-old woman doesn't get enough vitamin E. And, you know, vitamin E is the most important fat-soluble antioxidant. The first cardiologist I had in Florida said as I was getting ready to leave, "Now remember, don't take any vitamin E supplements." And I said, "Really?" I said, "That's interesting." I said, "Now, I like wheat germ. What do you think about wheat germ?" And he says, "Oh, wheat germ's good for you." And so, you know, this is a great start to heart health. It's the best science, the best ingredients, clinically proven. We know about the landmark study. We know that people who took Shaklee supplements for 20 years or longer had better health than people who took no supplements or people who took competitive supplements for 20 years or longer. There was no comparison. Shaklee products produced better health. And so we can't, no one can argue against that, and it's been published. As it says at the middle of that slide, the best, most comprehensive nutritional system in the world. So the right supplements do make a difference. Shaklee calls it the RX for a healthier life. The Life Strip, which contains the Vivix and Omega Guard and the other products, the Life Shake, which is once again a wonderful product. And the RX for a Healthier Life is available with either the Vitalizer or with the Life Strip. Some people like one, some people like the other. So, you know, the Vivix is improved, and it's so good. And then, of course, part of the RX for a Healthier Life is Nutriferon. And Bob could talk an entire hour on Nutriferon.
Yep.
It's that amazing of a product. And we talked about that a lot in our immune talk a couple of weeks ago.
Right.
But there's certainly significant advantages to using Nutriferon. And I'm very concerned that it's in short supply, and that kind of bothers me. But.
Well, yeah, everyone wants it.
Yes, and everyone wants more of it. But the other things that are really good, and there are some things like the essential fatty acids, and I'm really sorry this says women on the GLA complex, because it's absolutely not just for women. GLA, gamma linolenic acid, is an omega-6 fatty acid, and Omega Guard is the omega-3 fatty acids. And to understand how they work, I'd like to talk a little bit about prostaglandins. And prostaglandins, there's prostaglandin E1, which is a really good one. It prevents the blood platelets from sticking together. Anybody that's ever had a heart issue has probably taken Plavix, which is a drug that's created by the pharmaceutical industry that does exactly what Omega Guard does. And it prevents blood platelets from sticking together. Helps to prevent heart attacks and strokes. My cardiologist said, "Buddy, that's what saved your life." He said, with the heart blockages you had, those cells must have just been squirting through those blockages. And they were, because my cells were so slick. He said it saved your life. But it relaxes the blood vessels, improves circulation, lowers blood pressure, reduces inflammation, makes insulin work more effectively, enhances T cell function of the immune system. Doesn't that sound like something that everybody would want? So that's prostaglandin E1, GLA. And Shaklee has a product called GLA Complex that they say it's for women. I'm sorry, but wouldn't men want the same advantages? And so think about that. Let's talk about prostaglandin E2. Well, this promotes platelet aggregation, which is the first step to clot formation. And it increases the risk of a heart attack and stroke, makes the kidneys retain sodium, does all of those other things, causes inflammation. Everybody knows that's not good. Diets high in saturated fats containing arachidonic acid increase the levels of this. And there was a chief scientific officer for Shaklee when we first got involved. His name was Dr. Jim Scala. And he wrote a book on arthritis. And I'm actually in that book. And he was the guy who first told me about arachidonic acid, and it congregates in the fat of animals that live on 4 feet. And so prostaglandin E2 is not the one that you want. Then there's E3, and it's similar to prostaglandin E1, powerful effect on preventing the release of arachidonic acid. And this is what's in the omega-3 fatty acids. E1 is in the omega-6s, E3 is in the omega-3s. And so Shaklee's Omega Guard delivers a full spectrum of ultra pure pharmaceutical grade omega-3 fatty acids. And they support your heart, they support the immune system, all of those things. The recommended ratio of omega-6 to omega-3, everybody wants to know this, in the diet is 4-to-1 or less. However, the Western diet, which we all contribute to, is somewhere between 10-to-1 and 50-to-1. And there's a reason for that. Omega-6 fatty acids are in salad oils, canola, the popular healthy oils that we have turned to when we turned away from lard. And so people are actually getting probably too much omega-6 in their diet, and they need to increase the amount of omega-3s to balance that out. Another thing is that Smartheart cholesterol regimen. First thing is, once again, there's that Omega Guard that we talk about, so good. CoQ Heart, which is coenzyme Q10, and it has a special place in heart disease prevention, because from the day we're born, we manufacture coenzyme Q10 in our bodies. But as we age, our production continues to drop off. And I've read that oftentimes after the age of 65, we produce hardly any. And so that's compounded by the fact that the two major classes of drugs used to treat heart disease are statins for cholesterol and beta blockers for blood pressure. That's drugs of choice. And so both of those cause further depletion of coenzyme Q10 in our bodies. So it's really, really important that anybody who's taking those two drugs for certain needs to take coenzyme Q10, CoQ Heart every day. This Shaklee's CoQ Heart also has resveratrol, which is from the same as in the Vivix, so that's important. And then cholesterol reduction complex. This is kind of interesting in the way that it works, because in animals, the sterols are called cholesterol, cholesterol. In plants, they're called phytosterols. there is zero cholesterol in any plant, none, nil, zip. And so, but interestingly enough, phytosterols and cholesterol have a very, very similar chemical structure. So when you consume phytosterols, they get into your bloodstream and they attach themselves to all of the receptors that cholesterol would attach to. So that when you consume cholesterol, it has nowhere to go because all of those receptor sites are filled up with phytosterols. So the cholesterol is just carried through the gut and out the colon. At night, our liver manufactures cholesterol. And so if we have significant phytosterols in our blood, then even the indigenous cholesterol that we manufacture in our bodies has no place to go, so it's excreted. And so I said, you know, I'm the guy with the cholesterol level of 480. It's not proud. I'm not proud of that, but it's kind of a badge of stupidity, maybe. But my cholesterol, I just had it tested, I don't remember, like 2 or 3 months ago, and it was 139. And that's
Wow.
a big change from 480. And it's not all cholesterol reduction. A lot of it is fiber and dietary changes. And, you know, when we were married, June and I ate a whole cow every year. Every 6 months, we'd eat a half a beef. Every 6 months, we ate beef for breakfast, lunch, and dinner. And when we went out, guess what we ate? We lived in Nebraska, and it's not called the beef state for nothing.
No, I think that, Rusty, I think that's a point just to tarry over, because you were among the percentage of people who just picked wonderful parents that didn't have great cholesterol situations.
Oh.
So I'm sure they were great, but they passed that on to you. So you had to be extremely proactive in dropping, in being very, very, very strict with your diet, which then allowed, and this might be a time to kind of retell the story. Actually, you tell it. You know, what happened to those arteries that were all blocked? What happened to your heart that had a dead spot in it? What happened after you cleaned up your diet, hyper cleaned up your diet? You still had the Shaklee products, everything, but the big difference was that you're eating differently before. Now you're eating, you know, you were eating one way before, now you're eating very differently before, based on not wanting to die. What happened physiologically to you?
Well, you're from Iowa, where it gets cold in the winter, and I'm sure you've heard the story about the person lying in bed and they're really cold and there's a blanket on the closet shelf that would warm them up, but they can't force themselves to get out of bed.
And they're done that.
It's cold until it gets absolutely so cold they can't stand it. They get out of bed and they get warm. That's what happened to Rusty. It got so cold that I knew I had to change. I you know, some guy says you're going to live 2 years. You know, I'm sorry, that's kind of final.
Yeah.
And I wasn't done. Somebody said, well, when are you going to reach? One of my friends said the other day, you know, you're still working. And I said, yes, I am. And they said, when are you going to retire? I said, well, I've still got a lot of things I want to do. And maybe people don't understand that. So I did change. And I'll tell you the rest of the story right now, so you stop bugging me about it.
Yeah, exactly. Come on. Don't hold that on us.
So anyway, about 15 or 16 years after my open heart surgery, and by the way, I just on March 6th celebrated my 20th anniversary. So I'm, 20 years in 1 month. But anyway, I had my cardiologist said, you know, well, bypass grafts only last 10 years, and you're 15 years post-surgery. We need to check you out. So they did a stress test and an echocardiogram. And what they found is that with the echocardiogram, they found that 100% of my heart was alive and beating. And what they found from the stress test is that I had adequate blood flow throughout my entire heart. So all of my coronary arteries are good. All of my heart is alive and beating. And that's a real change from what it was 20 years ago. But I tell people, look at your finger, and in 7 years, you get like a whole new finger.
Yep.
You know, all the cells replicate, and people say, well, but I cut my finger and I have a scar there. Yeah, well, the scar cells replicate. And so if you are building cells that are better than the ones that are dying, because we have bazillions of cells that die every day.
Right.
So if the cells that are replacing the ones that are dying are better than the ones that die, your health slowly improves. Does it do it overnight? No, but it does it enough in the first 30 days that that Shaklee guarantees you'll feel better in just 30 days, and that's why you're building 30 days of good cells. On the other hand, if you don't change, I don't believe that you can remain the same. I think you either get better, or because of aging, you get worse.
Right.
And so that's what I did. I just started making super cells to replace the bums that were dying, and it really made a difference.
Well, and again, just to put a fine point on this, because it really demonstrates our philosophy in Shaklee that we don't attack disease, we build health. And it may be completely semantic whether when you turn on a light in the room, you're banishing darkness or you're bringing light, but it's essentially the same act, right? Turn the light on.
That's a good word picture. I'll use that.
Yeah. Turn the light on and the darkness goes away. So just taking a regimen, a good solid regimen of Shaklee products was not enough to allow you to build the kind of health you wanted. You need to also to shift your diet to something that was really clean. And then those two things, the Shaklee products very likely saved your life because it made your blood slippery and all kinds of other benefits. But I think it's really important for people to understand that if we're going to have optimal health, you just can't leave anything out. You can't take a bunch of supplements and then eat McDonald's hamburgers and never exercise. Or you can't eat a bunch of supplements and exercise, but not eat a good diet. I think it's super, super important for people to understand that. And then of course, part of that good diet is the Shaklee food. So it's not an easy thing to completely understand the interaction of everything, but I just want people to really think about that and think about what they're actually eating with their knife and fork along with everything else. Does that make sense, Rusty?
Yes, and the operative word in your sentence was optimal. You can improve your health if you start eating salads instead of McDonald's hamburgers.
Yep.
You can improve your health if you start exercising a few minutes every day. But if you want optimal health, you got to do it all.
Yep, that's it.
You got to sleep, you got to exercise, you got to eat right, but you have to supplement.
Yeah.
You cannot do it with exercise and diet. Too many clinical studies have shown that.
Well, and just
not get the same result.
Yeah, one final point on that I know you're aware of, but it bears repeating, that when Shaklee started to work with the Olympic skiers way back when, I think in the early 80s, they were finding that male skiers that ate 7,000 calories a day did not have adequate nutrient levels across a spectrum of nutrients. How many of us can afford to jam 7,000 calories worth of food through our system in order to get the nutrients? So yeah, I mean, my personal belief is you're absolutely right. You got to have it all, supplements included.
Yeah, and honestly, if I had to leave out something, that's the last thing I would leave out.
Yep.
Just because, and part of that is because Shaklee supplements aren't vitamins. Shaklee supplements are whole food. And because of that, you get a much better result than you would from vitamins. But on this slide that's on the screen right now, there's a couple of things that are important. Over on the right-hand side is garlic. And garlic does two things. Garlic raises good cholesterol, lowers bad cholesterol, and lowers blood pressure. And that's two of the risk factors for heart disease: lowering cholesterol, lowering blood pressure. I had a question the other day on my Phytobite. It says that the clinical studies in garlic has undergone thousands of clinical studies in Europe. And what they found is that the best results were with 3 to 8 cloves of garlic a day. And
Ooh.
so you can't take, you can't eat 1 clove of garlic and expect to get the results. 3 to 8 cloves a day. Well, that's 6 to 16 Shaklee garlic tablets. So do whatever you want, but if you want the best result, you have to use the product. We know that E is good. We know fiber is good. We know B complex is so good because it's water soluble, and the American Medical Association tells us that when you're under stress, you lose all your B complex in 12 minutes.
Wow. Wow.
You're driving down the road and somebody pulls out in front of you and you have to slam on your brakes. Well, you just burned up all your B's and all your C's, by the way. But anyway, really good things there. I don't know what I'd give up if I had to give up any of it. Fortunately, I don't have to give up any of it. The Optiflora DI is so good for gut health. And quite frankly, it doesn't make any difference in quality of food you put in your system if your system can't dissolve it and get it into the bloodstream. And that's where Optiflora DI, the probiotics, that's what they improve the way that our gut works. And so that's why that's there. And honest, the secret is to start now.
Wow, Rusty.
I'm done, Bob.
Unbelievable. All right. Well, so folks, thank you very much. This was terrific. Thank you all for being with us. And I'll get this transferred over and edited up and out to you. So thank you all. And Rusty, any final words for our folks?
Stay safe. Don't congregate.
That's right. Eat good. Take your supplements.
Eat good. Keep taking Nutriferon. Keep taking vitamin C.
Great. Thank you.
We want to keep having you on these calls.
Hey, keep having you. Oh, you're in, dude. You can't escape me. Right. All right.
All right.
Very good. Take care, all. Bye-bye.
Okay. Bye-bye.